Today we'll discuss about pseudothrombocytopenia. It is a phenomenon in which the number of the platelets reported by automated cell counters is much lower than the real number of platelets circulating in vivo. This is very important because this may lead to the erroneous diagnosis of thrombocytopenia. Sometimes it can lead to the unnecessary and costly additional laboratory testing and inappropriate treatment. So this pseudothrombocytopenia occurs because of the platelet clumping and sometimes because of the giant platelets, which are counted by an automated counter as a white blood cell counts rather than platelets. So the platelet clumping can occur because of the various causes like EDTA-dependent agglutinins are responsible for platelet clumping. Similarly, insufficient use of the anticoagulation can cause the platelet clumping. Similarly, sometimes the glycoprotein 2b3A inhibitors can also cause the platelet clumping. But among these, all these mechanisms, the most common mechanism responsible for the pseudothrombocytopenia is EDTA-dependent agglutination. So we'll talk about that in a little bit more detail. So how does the EDTA causes agglutination? It does so by two mechanisms. One is it leads to platelet clumping, and next is it leads to platelet satellitism. Platelet clumping occurs because when EDTA is added to a blood sample, it exposes the cryptic antigens in the platelet membrane, and the naturally occurring platelet autoantibodies, they can bind to those antigen, and there is agglutination. Similarly, because of this EDTA, antibodies against glycoprotein 2b3A, they attach the platelet to the neutrophils, leading to the platelet satellitism. So these are the two mechanisms by which EDTA can cause platelet clumping, and this leads to the pseudothrombocytopenia. This picture illustrates the same mechanism. So how can we diagnose the condition? For the diagnosis, we can examine the blood film. In the blood film, we can see the platelet clumps and we can see the satellitism. In satellitism, platelets, they form the rosette around the neutrophils and the monocytes. So this is a blood film showing the platelet clumping. As you can see in this picture, there are a lot of the platelet clumps. This leads to the false low platelet count by the automated analyzer. Similarly, here also you can see the platelet clump. In this peripheral blood smear, you can see the satellitism. You can see that the platelets are around this neutrophil or polymorphonuclear cells, as well as in this film, you can see the same phenomenon. So this is also one of the mechanism responsible for the pseudothrombocytopenia. And in this blood smear, you can see the giant platelets. You can see that the platelets are almost of the size of the red blood cells, and these platelets are usually counted by the automated counter as the WBC rather than the platelets. So this leads to the falsely low platelet counts. So how can we prevent this pseudothrombocytopenia? So for the prevention, we can use the anticoagulants other than EDTA, like we can use sodium citrate, heparin, or magnesium sulfate because the clumping is less seen with these anticoagulants. Next important thing is we need to maintain the sample at around 37 degrees Celsius before testing. And similarly, in certain situations, we can directly take the non-anticoagulated blood and it can be directly poured into the platelet counting diluent fluid, and then we can examine the platelet. So these are the references which we have used for making this video. Thank you so much for watching. Subscribe to our channel for more videos.